You wake up feeling terrible. Your throat is sore. Your head is pounding. Maybe your body feels weak, and you know exactly what to do. You walk to the medicine cabinet. You take a pill. A few hours later, you feel better. It's so normal that you probably don't even think about it. But imagine living in a world where that tiny pill didn't exist. No antibiotics. No hospitals. No doctors with years of medical training. No pharmacies waiting around the corner. Now imagine getting a simple infection from a small cut, or developing a fever, or breaking a bone. For us, these problems can often be treated. For ancient humans, they could become deadly. And yet, somehow, our ancestors survived. For hundreds of thousands of years, humans faced disease with almost none of the medical knowledge we take for granted today. So how did they do it? How did ancient humans survive sickness when they didn't even know what bacteria or viruses were? The answer is far more fascinating than you might expect. Because ancient medicine didn't begin in a hospital. It began with observation. Imagine walking through a forest thousands of years ago. You have a headache. Your stomach hurts. You have a wound that won't stop hurting. There is no pharmacy. So where do you go? You look around. And your ancestors did exactly that. Over countless generations, humans observed the plants and animals around them. They noticed that some plants could make people feel better. Others could reduce pain. Some might help with wounds. And others could be deadly. The process was slow. And it was dangerous. Someone tried something. It worked. The knowledge was remembered. Someone else tried something different. It failed. That lesson was remembered too. Over generations, this created a kind of natural medical library. And some of the evidence is surprisingly old. Take Otzi, the famous 5,300-year-old mummy discovered frozen in the Alps. When scientists examined his belongings, they found 2 pieces of birch polypore fungus attached to a leather cord. Why was he carrying them? Scientists still debate the exact purpose. But birch polypore contains compounds with antimicrobial and anti-inflammatory properties. And Otzi himself showed evidence of intestinal parasites. That doesn't prove he was carrying the fungus as a carefully designed medical treatment. But it does raise an intriguing possibility. Perhaps he knew from experience that the mushroom was useful. And Otzi wasn't alone. Much older evidence suggests that Neanderthals may also have understood the medicinal properties of certain plants. At the archaeological site of El Sidrón in Spain, researchers found traces of plants such as yarrow and chamomile-related species in Neanderthal dental plaque. Some of these plants have known medicinal properties. And importantly, they don't appear to have been important sources of calories. So why were they eating them? One possibility is simple. They may have been using them because they had learned that these plants made them feel better. Think about what that means. Long before humans understood germs, long before anyone knew what inflammation was, people were experimenting with the world around them. They didn't know the chemistry, they didn't know the biology, but they could recognize a pattern. Whenever I eat this, my stomach feels better. Whenever I put this on a wound, it heals differently. Whenever I chew this bark, my pain becomes easier to tolerate. That knowledge could then be passed from one generation to the next. And one of the most famous examples involves a tree. The willow. For thousands of years, different cultures used willow bark for pain and fever. Centuries later, scientists developed modern aspirin from related chemistry. So the next time you take an aspirin, remember this. The modern tablet in your hand is the result of advanced chemistry. But the idea that certain natural substances could reduce pain and fever is much, much older. Ancient humans didn't understand the science. They simply discovered that something worked. Imagine having a severe head injury thousands of years ago. Today, you might be rushed to a hospital. Doctors would scan your skull. Surgeons would use sterile instruments. Anesthesia would prevent you from feeling the operation. Ancient humans had none of that. And yet, some of them performed surgery on the skull. The procedure is known as trepanation. It involved creating an opening in the skull, sometimes by scraping, drilling, or cutting into the bone. Evidence of trepanation has been found at archaeological sites across different parts of the world. Some of these skulls show clear signs of healing. And that detail is incredibly important, because healed bone means the patient survived the procedure. Ancient surgeons were not simply cutting into skulls randomly. In some cases, they were performing a deliberate procedure that could be repeated and passed down. Why? We can't know for certain. Possible reasons include treating traumatic head injuries, relieving pressure after a skull fracture, or attempting to address conditions that ancient people associated with severe pain or unusual behavior. But here's the truly astonishing part. Some people survived. Without modern anesthesia, without antibiotics, without modern surgical equipment, without knowing anything about bacteria. It would be a mistake to imagine ancient surgery as primitive versions of modern hospitals. It was far more limited. It was dangerous. And many patients certainly died. But the evidence proves something important. Ancient humans were capable of observing injuries, developing techniques, and passing medical knowledge from one generation to another. And that knowledge didn't always belong to everyone. In many societies, certain individuals became specialists. People who knew the plants, the treatments, the rituals, and the techniques. These people were often healers. And sometimes, they were what we would call shamans. In a modern hospital, medical knowledge is stored in textbooks, databases, and digital records. Ancient societies had none of these. So imagine that your entire community's medical knowledge exists inside people's memories. One person knows which plant can help with a stomach problem. Another knows how to treat a wound. Someone else knows how to set a broken bone. And one particular person remembers more than anyone else. If that person dies, the knowledge could disappear with them. This is why healers may have played such an important role in ancient communities. They weren't necessarily doctors in the modern scientific sense. They didn't understand germs or antibiotics, but they could possess an enormous amount of practical knowledge. They knew what had worked before, and they knew what had failed. Archaeological discoveries sometimes show that certain individuals may have held special roles within their communities. For example, researchers studying a roughly 12,000-year-old burial from the Natufian culture in the Levant found a woman buried with unusual objects and animal remains. The burial has been interpreted by some researchers as evidence that she may have been a ritual specialist or healer. We can't know exactly what she did, but the possibility tells us something fascinating. For ancient humans, healing may have existed at the intersection of practical knowledge, tradition, and belief. A healer could be part pharmacist, part surgeon, part caregiver, and part spiritual leader. But even with all this knowledge, ancient humans faced a terrifying enemy. One that could spread from person to person. One they couldn't see. Ancient humans didn't know bacteria existed. They didn't know viruses existed. They didn't know that microscopic organisms could enter the body and multiply. But they knew something was wrong. They saw wounds become swollen. They watched people develop fevers. They saw illnesses spread through communities. They may not have understood the cause, but they understood the danger, and they learned through experience. One of the body's most obvious responses to infection is fever. Today, we understand that fever is part of the immune system's response to certain infections. Raising body temperature can make conditions less favorable for some pathogens and can support parts of the immune response. But that doesn't mean every fever is harmless. High or prolonged fever can be dangerous, especially in young children and vulnerable people. Ancient humans obviously didn't understand the immunology behind fever, but they may have learned through experience that warmth, rest, hydration, and care could help someone recover. They didn't need to know the microscopic reason. They only needed to notice what happened next. Someone became sick. The community cared for them. The person either recovered, or they didn't. And every recovery became another lesson. Every death became another warning. Over thousands of generations, these experiences accumulated. But there was still one enormous problem. Even if ancient humans knew how to treat certain illnesses, they couldn't save everyone. Life for ancient humans was not simply difficult. It was brutally unforgiving. A small wound could become infected. A contaminated source of water could make an entire group sick. A respiratory infection could spread through a community. And childhood was especially dangerous. Many ancient populations experienced high childhood mortality compared with modern societies. But here's the part that's easy to overlook. Ancient humans didn't survive because they had perfect medicine. They survived because they had many different strategies. They cared for one another. They learned from plants. They developed practical treatments. They sometimes performed surgery. They isolated themselves from danger when necessary. They passed knowledge between generations. And most importantly, they worked together. The same species that could hunt large animals also learned how to care for injured members of the group. The same humans who had no idea what bacteria were could still discover that cleaning or treating a wound sometimes improved the outcome. The same people who didn't understand chemistry could discover that certain plants reduced pain. They were constantly learning, constantly experimenting, constantly adapting. And that's the real story of ancient medicine. It wasn't one brilliant discovery. It was thousands of tiny discoveries made over thousands of years. Some were wrong. Some were dangerous. Some were forgotten. But some worked. And when something worked, people remembered. Then they taught someone else. And eventually, the knowledge traveled across generations. Observation became tradition. Tradition became organized medicine. And organized medicine eventually became the science we know today. So the next time you swallow a pill for a headache, think about how far humanity has traveled. That tiny tablet represents centuries of chemistry, biology, experimentation, and scientific discovery. But behind all of it is something much older. A human being who was sick, and another human being who decided to help. We didn't invent the desire to heal. We inherited it. And perhaps that's one of the greatest reasons our species survived at all.